Good afternoon, everyone. Sounds like you can hear me okay. My name's Leah Hollins. I'm the chair of the board of Island Health, and I have several remarks to make. People are looking aghast because that's not what my notes say, but before I make my remarks, so we have a welcome video from Island Health that we're going to show you. So we'll do that now, and then I'll come back to the podium.
Serving 875,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-Chulnith cultural families. The Island Health family includes 27,000 healthcare professionals and 1,000 dedicated volunteers. 2,900 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities, with more than 6,600 long-term care beds, nearly 1,400 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3 billion. Each year, this funding supports 491,000 visits to emergency departments, more than 73,000 surgeries, 59,000 MRIs, 152,000 CT scans, 2,100 telehealth visits, more than 51,000 visits to urgent and primary care centers, over 16,000 home health monitoring visits, and 463,000 home health care visits each year. Island Health has expanded our primary care services with 7 Island Health urgent and primary care centers, and we partner in 3 community health centers and 7 primary care networks across the region, with further expansion in the works. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 600 inspections of licensed care facilities, and 4,500 inspections of food service operations. Public health nurses provide more than 5,000 perinatal home care visits, and in partnership with First Nations Health Authority and community pharmacies, more than 2 million COVID vaccines have been provided in Island Health. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
On behalf of my colleagues, welcome to our public forum. Whether you are joining us in person here at the Best Western Barclay in Port Alberni or online through our live stream. I acknowledge that we are on the traditional territories of the Hupetchesett and Tseshaut First Nations, as well as the other 13 Nuu-Chulnith Nations cultural family. We also recognize the Métis, Inuit, and other Indigenous peoples across Canada. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done to Indigenous peoples, such as the cultural genocide and assimilation of Indigenous people. the residential school system, and the recovery of graves of Indigenous children, the too many missing and murdered women and children, and the social inequalities and racism which exist today. Excuse me. I invite you to think about the responsibility we each have to act in a spirit of reconciliation, healing, and collaboration. Public forums allow the board to meet the people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former Deputy Minister of Health, a former nurse, and the chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Because caring for the patient is why I started working in healthcare, and I continue to support the delivery of health and care. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our directors, who are responsible for the overall direction of Island Health. The board consists of 9 directors. In addition to myself, the board includes Shawnee Cassavant. Maybe you can just give a wave, because I don't think people can necessarily see our name tags from the back. Shawnee is from the Hupatchesat and Tsayshot Nation, First Nations on the West Coast. Vivian Hermanson from Campbell River. Diane Brennan from Nanaimo. Ann Davis from the Comox Valley. Ron Matson from View Royal. And Ann McFarland from Victoria. Unfortunately, 2 of our board members could not be here today. Alana Nast from Victoria and Ron Rice, a member of the Cowichan tribes who lives in Victoria. Excuse me. Seem to have acquired a frog in my throat. We also have local leadership and executive management team members joining us this afternoon. And I'll ask you now to stand and give a wave so that we will all be able to identify who you are. Great, thank you so much. You will hear from some of them later this afternoon. Thank you. Thank you. We have a full program today. Island Health's President and CEO, Kathy MacNeil, will begin by providing an update on the delivery of health and care services across Vancouver Island, and in particular, here in Port Alberni. Dr. Sandra Allison, Medical Health Officer, will speak about public health and wellness in the region. We'll then have a presentation from regional staff on access to community health services, followed by a community presentation from the Alberni Valley Hospice Society. The last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance, and I will open the floor to those questions so the board can hear from you. And now I'd like to invite Kathy MacNeil, Island Health's President and CEO, to say a few words.
Thank you, Leah. And good afternoon, everyone. Thank you so much for coming to, and being with us here today. I too am grateful to be able to meet and work today on the lands of the Hupatchesat and Tsayshot nations, as well as the other 13 Nuu-chah-nulth nations in this region. And I'd like to acknowledge and just name that we are holding up residential school survivors here in the region and across Vancouver Island, and in fact across the country. As we know, Seychelles is doing the important work of discovery here in relation to the residential school. We at Island Health know that there's much work for us to do when it comes to reconciliation. And we know we're at the beginning of a long journey. Every step we take is a step towards acknowledgement, understanding, and change. This morning, the board members and some of us visitors visited the newly renovated emergency department at the West Coast General Hospital, which will officially open this spring. I'm not going to give you a date because I'm not 100% sure of the opening date, but we know it's soon. The redevelopment includes a 244 square meter expansion, as well as improvements to the existing emergency department space. The new build will create better patient flow with the adjoining triage registration area and will improve the line of sight to existing rooms. And we have heard over the years how important this is to be able to deliver safe care. The changes will not only support and improve patient care, they'll also make the working environment much more efficient and more safe for the clinical staff. We're very grateful to the West Coast General Hospital Foundation and the many generous community donors who raised $2.4 million to support the renovation. And this is $400,000 above the original goal that was set. Incredible support from the foundation and from the generous donors here in this community in Port Alberni. I'd also like to thank the Alberni-Clayoquot Regional Hospital District, who contributed $1.7 million to the renovation. Improving health takes more than the work of the healthcare system. Here in Port Alberni, Island Health works closely with community partners to deliver health and care, many of whom are here today, including representatives from the First Nations of Seychelles and Hupecheset, the First Nations Health Authority, New Chalmouth Tribal Council, the Port Alberni Friendship Center, Port Alberni Shelter Society, the Regional Hospital District, municipal, provincial, and federal government partners, West Coast General Hospital Foundation and Auxiliary, the Division of Family Practice, the Port Alberni Hospice Society, whose presentation I'm looking forward to hearing later. At the board's invitation, many of these groups joined us this morning at a breakfast meeting. We had an excellent conversation about our shared responsibility and the actions we can take in addressing the toxic drug tragedy here. We know communities across the province have been devastated by this public health emergency, and we also know that much higher rates of drug poisonings have been experienced here in Port Alberni. In 2022 alone, 25 people died in this community from toxic drugs. There really are no words to describe the sorrow that we feel at the loss of these community members. Every death impacts the entire fiber of the community. We also know there are a multitude of factors at play when it comes to the toxic drug crisis. With our community partners, we are working to try and stem the tide. This morning, we heard from two nurses at Island Health, Colleen McEwen and John Brown, who are the first two nurses on Vancouver Island to administer and prescribe opioid agonist therapy. And we're grateful to Colleen and John for demonstrating such courageous commitment and going first. Opioid agonist therapy is an effective treatment for addiction to opioid drugs. And this therapy involves taking methadone or Suboxone. These medications work to prevent withdrawal and reduce cravings for opioid drugs. And people who are addicted to these types of opioids can take opioid agonist therapy to stabilize their lives, to prevent withdrawal, and to reduce the harms related to their drug use. This is just one of the many tools that partners and members of the Island Health team are using to try and curtail the devastation of this toxic crisis. And we know that the realm of treatment, of interventions, go from harm reduction through to treatment into recovery, because recovery is always possible. A new intensive outreach response team is a community outreach service that provides supports and interventions for people who need medical support, nursing, harm reduction services, overdose prevention, housing, and connection to other mental health services, primary care, and other community partners. The Assertive Community Team provides flexible, community-based support for people who are not able to access clinics in the community. This mental health service delivery model is evidence-based, person-centered, and recovery-oriented. Supporting youth with mental health and substance use issues is also critical. In early December, the Port Alberni Youth Short-Term Assessment and Response Team, or as we refer to it, YSTAR, we have lots of acronyms in healthcare. YSTAR was part of a provincial announcement focused on the new mental health and substance use services for young people. This community-based wraparound team supports youth from the ages of 12 to 21 who have significant mental health and substance use concerns or who might be in a substance use crisis impacting their ability to engage in day-to-day activities. While there's still so much work to be done in this area, last year, 77 people were brought back to life from an overdose inside the Port Alberni overdose prevention site. To date, there's not been a single death reported at the overdose prevention site. We also know Indigenous people have been disproportionately affected by this toxic drug tragedy. We walk with First Nations partners to guide us in culturally safe services as we work together. In Port Alberni, we're funding 10 additional substance use supportive recovery beds, which are operated and led by a local Indigenous service provider. The service will prioritize members and residents of the New Chalmers territory, and those will be opening later this spring. I'd like to talk a bit now about the delivery of some other community and hospital services here in Port Alberni. As I'm sure you're all aware, hospitals and healthcare systems across the country are facing many challenges. Those include recruiting and retaining staff in the face of growing demands on our system. West Coast General Hospital is not immune to these challenges and also has been struggling with staffing, in particular emergency department physician coverage. Having stable staffing is critical to providing safe and reliable care. I want to thank West Coast Chief of Staff, Dr. Sam Williams, who has worked tirelessly to ensure physician shifts in the emergency department have been covered. And we know it's often possible for people to be cared for outside of the hospital. Being able to support people at home not only aligns with what they want as their care needs increase, it also helps reduce burden in hospital facilities. In Port Alberni, the Community Health Services team support people living with chronic conditions or frailty and coping with end of life to stay better and stay well at home. For example, the addition of a respiratory therapist in the community will help clients cope with chronic obstructive pulmonary disease and other respiratory ailments. We're focused on recruiting and retaining home support community health workers to help people stay in their homes. Recently, 14 Healthcare Access Program graduates were hired here in Port Alberni to work in home support. We're very proud and grateful to the Port Alberni Community Health Services team. They are a shining example of an adaptive team working to meet community needs. Technology is another tool that enhances access to care. The Community Virtual Clinical Care is a free program which supports clients to better manage their chronic conditions in the comfort of their own homes. Registered nurses monitor clients' vital signs and have regular contact with them to ensure they're on track to meet their goals. This service was recently expanded to being available 7 days a week, 12 hours a day. This team is linked to the community team on the ground to ensure that virtual clients can also receive in-person care if they need it. As you've heard, at Island Health, our vision is to provide excellent health and care for everyone, everywhere, every time. We work to create healthier, stronger communities and a better quality of life for all. This work is rooted in our values of courage, aspire, respect, and empathy. They guide us in good times, and they certainly guide us in times of uncertainty. In fact, our recent employee engagement survey showed that 7 out of 10 Island Health employees are engaged or highly engaged, and they also strongly believe in our vision and our care values. This dedication is evident in the work of our staff and is recognized by others. On that note, I want to share just a few pieces of news. Island Health was recently acknowledged for going beyond nationally recognized standards for excellence in delivering services focused on improving the quality, safety, and experience of care for patients and families by Accreditation Canada. Accreditation Canada is an independent organization that assesses health care across Canada and around the world using evidence-based standards. Part of this review is an on-site survey done by volunteer external peer reviewers to evaluate our practice against those standards. One of the teams surveyed was Port Alberni's palliative care team, and I want to thank them for the incredible work they do. I also am proud to say that Island Health has been named one of British Columbia's top employers for 2023. BC's Top Employers competition identifies employers who lead their industries by providing exceptional workplaces for their employees. This award recognizes the wonderful teams and work environments across this island. We are so proud of the dedicated workforce who work hard in often challenging conditions to provide excellent care for the residents across the island. And finally, some of the people who work in your community are here today. I'd like to recognize Pam Reardon, who is the site director of the West Coast General Hospital. Dr. Greg DePape, I don't think Dr. DePape is here this evening, who's also the medical director for the hospital. Dr. Sam Williams, who's the chief of staff. Leslie Howie, who's here this evening, who's the director for mental health and substance use. And you'll be hearing momentarily from Dr. Sandra Allison, who is your Chief Medical Health Officer for this region. I know there are other leaders here in the room. And I just want to say personally how deeply I am grateful to each of you for leading in healthcare today. It is not easy to be a leader. And this is more than ever do we need to have leadership in this industry and in healthcare. And I'd like to close by thanking each one of you for being here with us today, for being interested in your healthcare services here in Port Alberni, and for walking along this road with us. Thank you.
Thank you very much, Kathy. And now I'm really pleased to have, still there, our medical health officer, Dr. Sandra Allison, to provide an update on the health and wellness of the population in Port Alberni. Dr. Allison?
Thank you, Board Chair. Thank you, Kathy. And thank you, everybody from community, for coming today. I'm hopeful that I can see my slides, and I'm looking at Tyler from the sign. Yes. Oh, I think I should be fine. Yeah. So thanks again. Thank you for inviting me to speak. As a medical health officer, it is my role to speak on issues that are important to the community. So change slides, please. So I am grateful to be here on the lands of the Seychat and the Hupatcheseth First Nations, as well as the lands of all of the New Chalmouth family. And we do support the local health area here. And I just have a map of it because I'm a nerd and we do maps and data and stuff. So I really just wanted to reflect that we do have 3 community health service areas included in the local health area. And when I speak to data, I refer to these divisions just for everybody's information. I'm really grateful to the team for putting the data together. And we've used multiple data sets just to inform this, so thank you. The current population is over 34,000 in the community of Alberni and in the local health area. And that is projected to grow over the next 10 years, about 7.5%, about 12% in the next 10 years. And the largest age group really is that over 75, and I think that's really important when we think about services and how we define services to meet the needs of our community. Compared to the BC average of 5.9% population reporting Indigenous identity, in this area we have a very strong Indigenous identity, about 2.5 times the population, the provincial average reporting Indigenous identity. And that brings so many rich attributes, including connection to land, connection to culture, really important positive attributes. The income in the communities in the local health area is lower than the BC average by about $13,000 annually, and that's pretty important when we think about what determines health. Income is one of the most important determinants of health. And many people in this area report low income. In fact, the ages groups, and you look at the graph, it's from young to adult to seniors. In the blue bar, the Alberni area has higher numbers of people reporting low income than other areas of the island and in British Columbia. Only about 54% of the respondents in the local health area reported a post-secondary education, and that is also an important determinant of health. We know that people who have advanced education can have higher incomes, and that's something that we need to understand when we think about the population. In fact, when you look at the island, we do have a lower percentage in other areas, but Alberni-Clayoquot being one of the lowest. In the region, we have lone parent families as well, a higher rate of them, 18.5% of there were single parent families, and that's compared to the provincial average of 15%. So our families are less well educated, have lower income, and many more that are single parent families. So that's really important. And then people are living to a shorter life expectancy here in the region. When we look at that region of the local health area, people are living about 6 years younger than the provincial average. I think that that's really important. When we look at to break it down by sex, males and females are living about 5 years less for both sexes in this area. And what's contributing to that is the illicit drug toxicity crisis. We know that that's driving many of the fatalities and in fact lowering that average life expectancy for both sexes. When we look at the graphs on the left, there's potential years of life lost. So we kind of expect people to live to about a happy 75, and anybody that lives less than that has lost some potential years of life. The toxic drug crisis is the bar in yellow, and that's the second highest cause of potential years of life lost. And unfortunately, the toxic drug crisis is really the sixth lowest, like the sixth highest cause of death. So that it's really disproportional, a lot more people dying and losing really important potential years of life. When we look at the breakdown by sex in the deaths in the Alberni area, 30% of the deaths were reported to be women. And when we look, or females, and when we look provincially, that's 20%. So it's almost 50% more women experiencing a toxic drug fatality in this area. And in this area, 25 people, as Kathy have said, have lost their lives in 2022. It's higher than 2021. But when you look back the years previous, it wasn't so high. So what has changed? We're really, really looking hard at this. It's very concerning. Every one of those is a family member, a brother, a sister, a mother, an aunt, an uncle, fathers. The rate in the area is really high. It's about 3 times or double at least. You know, we were looking at 90 deaths per 100,000 population in this area compared to our regional rate. Strikingly high. Next slide, please. We do have some information about drug samples. We have a drug checking program in the island, and when I see the samples coming from the Port Alberni area, it does seem that there's a higher proportion of samples that are submitted that people think are opioid down, and That is quite possibly the case, that there is more opioid use here. What we know about opioids is only about 1 in 5 samples of opioids are exactly what they think they are. The other 4 out of 5 samples have toxic analogs, fluorofentanyl, other benzodiazepines, these new things like xylazine or tranq. And so we know that people are being exposed to other substances in the opioid supply, and that's why prescribed safer supply is so important. Next slide. The First Nations data, the First Nations Health Authority and our excellent partners have given us information, and that really Indigenous people are experiencing 5 times the burden of death related to the drug crisis. So just acknowledging that that's an incredible burden on individuals, and it's preventable. Next slide. These coordinated efforts from the provincial government, to advance many of these important initiatives, access through multiple strategies, in focusing on Indigenous-led initiatives, I think is really important, including focusing on client safety, cultural safety, and humility, and ensuring that our services are welcoming of people who use substances. A comprehensive system of care, evidence-based services, including the spectrum of substance use treatment, which we spoke of, and harm reduction, improving access to drug checking, overdose prevention, opioid agonist treatment, and prescribed safer supply are all very necessary right now. Across the Central Island, mental health and substance use services are being expanded to meet the needs of communities, both small and large. Next slide. And in addition to those important expansion, we are working really hard in public health to move upstream and work at that, when people are, ready for care or even just engaging with care in public health. We work with our partners in the school district, trying to ensure access for youth in drop-in clinics. In our own clinic space, ensuring we've got our perinatal programs restarting and trying to engage families in some of the basic things that we can help in build skills. And we have a health outreach program, and that's an amazing innovation, just like the other innovations in Port Alberni. You never disappoint in that people are really willing to come together, and that health outreach program is really seeking to serve people who are most vulnerable. Next slide. And early registration with the public health teams through the Right from the Start program is a really great way to have newly pregnant people connected to services early on, because we know that when people have a new pregnancy, they're looking at ways to make different changes in their life and lead healthy lifestyles. So next slide. In so many ways, I just want to remind folks that the social determinants of health in our lives impact our health outcomes. They really do, including the mortality, injury, and risk behaviors that people partake in. Access to affordable and safe housing, welcoming social settings and welcoming service settings are both essential. Like, our services have to be welcoming, but our communities have to be welcoming, because we need to accept people where they're at. These are human beings, and we want them to be well, and they're people in our community. There are inequities to access in our care, and these inequities can be, inequities in social elements, and they can be institutional inequities, and we know what some of those are, and I think we internally are trying to break down as many of those barriers to care that we can. But those persistent inequities in society, due to some insurmountable structural and institutional barriers, continue to impact health and social outcomes in our communities. So I'm really pleased when we have community meetings like this, because local strategies and partnerships are really the key, and it's like local commitment and community commitment to kind of really offset the cycle that we're in, I think is where we need to go. So in closing, several of the important social determinants of health in the area here, in the local health area, are lagging, and that's really, it's in the data, and we can see it, and we know that that causes outcomes. We're observing those worsening health outcomes, including worsening rates of chronic diseases, diminished resilience, and worsening drug poisoning deaths. The drug poisoning deaths are disproportionately impacting First Nations people. We've heard that. And in the local health area, in a larger population, more females seem to be impacted here in our community than elsewhere as well. It is possible that the local culture of opioid use is driving some of this. I'm not really sure, but I continue to dig deeply into this. But I want to say I am very, very thankful to the partners, to the providers and community, our New Chalmers Tribal Council partners, First Nations Health Authority partners, the Division of Family Practice, because they're all really important to strengthen the services that are here. And I really do think that the local solutions are what's going to make a difference in this toxic drug crisis. So thank you.
Thank you very much, Dr. Allison. I know I can confidently speak on behalf of my colleagues who are very grateful to our medical health officers for the work they do in the communities that we serve and how important the work is you do to the health of our communities. It's not always about hospitals and other of those kinds of services. So thank you very much for that. And we now have a special presentation on local services and community health supports in Port Alberni. Our presenters are Shelley Gallant, the Executive Director for Primary and Community Care for Central and North Island, and Alicia Pauling, Manager for Community Health Services for Port Alberni. Welcome, Shelley and Alicia. So I'm just going to sit in your seat, I think.
Thank you, Board Chair, and thanks for having us. We are here to talk about community health services. And so in community health services, we aspire to support people to maintain their independence and their wellness in the home and in the community for as long as possible. Next slide. So we have a number of services that help support people to maintain that independence and wellness at home, ranging from professional services that we deliver in people's homes to non-professional services like home support, where we support people with maintaining their independence and maintaining their ability to support their own activities of daily living at home. And we have a number of other services that support people to stay well and maintain independence, some in facilities. So we have bathing programs, adult day programs. We provide care and assisted living. We have long-term care. We have a wide range of services that also help people that are coping with end of life, so palliative care, and we also support caregivers because we've realized how important it is to support informal caregivers who are also supporting people to maintain independence and wellness at home. Next slide. So to access community health services, we've made it as easy as possible for people. So we have what we call a single point of access, so just one phone number, and you can call that one phone number and you can explain what your situation is or services that you're looking for, or maybe you're looking to see what services there are. And so we have a toll-free number, and we did bring some pamphlets and some cards that people could take away with them. And if you know anybody that could benefit from community health services, it's self-referral. You do not need a primary care provider to receive services. Your neighbor you can refer your neighbor or help your neighbor refer themselves. So we encourage you, if you know anybody that needs support at home, please encourage them to contact us. Next slide. And just sort of jumping off of what Dr. Allison was talking about how the life expectancy is impacted by the burden of chronic disease. We really, as we're developing community health services and services that support that independence and that wellness at home, we're really looking at what is the burden of disease. And so this data is taken from our local health area. And so what other services or where do we have gaps where we need to actually help people to maintain and wellness at home. So for instance, chronic obstructive pulmonary disease is a area where we did not have services before, and we've just recently started to add those services to help support people at home with that. Next slide. So now Alicia is going to talk a little bit more about Port Alberni and some of the exciting things that are happening to support people here in Port Alberni.
Welcome, everyone. So some really exciting innovations and pieces that have been shifting and happening over the last couple of years, such as virtual care. So we have community virtual clinical care. So that provides supports to clients and provides education, enhances the self-management of their disease. So really putting the client in the driver's seat and empowering them. Recognizing when to seek primary care or emergency care services. supporting heart, kidney, chronic obstructive pulmonary disease, diabetes, and palliative end of life. There's also caregiver support networks, so intensive caregiver and care partner supports, so that we're really holistically wrapping around the client and their families. Family Caregivers of BC is also another additional resource. In community health services, there's been some innovation around supporting clients that have diabetes, where they require insulin management supports to maintain their independence and home, where they might have otherwise been admitted to long-term care. So it's really looking at optimizing and supporting clients to stay in home as long as possible and as long as that is their goal. Respiratory therapy services, so there was a mention earlier that we will be adding a respiratory therapist to community health services who will be able to provide those additional supports, which will be for Port Alberni and the West Coast. We provide wound care, so we provide basic wound care and advanced wound care, compression therapy. We have a nurse that specializes in wound and ostomy care and supports the education of clinicians in the community. We have an ambulatory care clinic at our community health services building where we can provide supports to clients that are able to come in, and we are open 7 days a week. As well, we have home care nurses that go into the home, so RNs and LPN that can provide wound care supports and really optimizing and supporting the client to be at the center of the care, and sometimes the clients are empowered to do their own dressing changes in collaboration with their nurse. We also have geriatric specialty support services, so those clients that need additional assessments and connection in with our geri psychiatrist. We have registered nurses that operate out of the Community Health Services building on 6th Avenue, and they collaborate with the other professional team members in Community Health Services, as well as the geri psychiatrist in our community. Next slide, please. We have practice-linked nurses, which is quite innovative and started in 2016, and they are a bit of a gold star in this community. And really what they do is collaborate and integrate across the care continuum. They're a part of the Community Health Services team to improve patient health services and reduce reliance on hospital services. So currently they are working in 7 primary care physicians' offices, really supporting the physician and supporting clients that have chronic disease, mental health, perhaps substance use. Really look at connecting and linking those clients into services, whether it's mental health services that are needed, whether it's public health services that are needed, or community health services. So they work intensely and closely with the primary care providers and really linking the clients to other services. We also support our clients who are marginalized and on the street. So we go out to them. So it's a street outreach support. We go to the overdose prevention site. We go to the Bread of Life. We used to go to the Bread of Life. And we also go to other areas in the community where those clients need service to make sure that they get the best care at the right place at the right time. Next slide, please. We have services to support palliative and end-of-life care, and I think there's a real pride in terms of our partnership with our community Alberni Valley Hospice partners, as well as we have Ty Watson House, which is a 4-bed hospice, which is a partnership and collaboration between Community Health Services and Alberni Valley Hospice Society, where we provide end-of-life care to patients and circle supports around families and caregivers. We have the community virtual palliative care, which is early connection and care for individuals diagnosed with a life-limiting illness to support them at the early stages, as well as we have in-home palliative care and supports, where we have registered nurses, we have licensed practical nurses and other community health services care teams, our community health workers that go in to provide care for clients to support them up until end of life, and they circle support around the family and the caregivers. There is palliative care consultative services, so we're very blessed to have a palliative care coordinator that's embedded within our community health services team, as well as We work in collaboration with our palliative care physicians and other primary care physicians in the community. There's also support and care for medical assistance in dying. Next slide. Thank you.
Thank you very much. The board had the opportunity earlier today to spend some time with Shelley and then with Alicia and her staff. And I think it's, again, I can say on behalf of my colleagues how impressed we were with the services that you're providing. And we would have all come to work for you if we'd have had the opportunity to do that. I just want to go to the board, though, and ask the board if they have any further questions for Shelley or Alicia. No? Okay. So now it's my pleasure to welcome a community presentation, and I'll invite Teresa Ludvigsen, the Executive Director of the Alberni Valley Hospice Society, to the podium. Welcome, Teresa.
Thank you very much, Leah, and thank you for the correct pronunciation of my name. So good afternoon, everyone. My name is Teresa Ludvigsen, and I'm the proud Executive Director of the Alberni Valley Hospice Society. And we have been operating in the Alberni Valley for, I think, 41 years at the moment. And so we also have a community-based 4-bed palliative residential hospice, referred to as Ty Watson House. So thank you for the opportunity to share with you information about our services and our prized newest initiative, which is the Children and Youth Grief and Bereavement Counseling Service. So this was a dream of our society for many years to recognize the need within the community. So as you're aware, you know, the Alberni-Clayoquot region is a vast area and includes the communities of Bamfield, Tofino, Ucluelet, and access to palliative care services can be a challenge, of course. Our society's catchment area encompasses the whole region. So the Hospice Society provides community-based services in addition to those provided at Ty Watson House. And these services include bedside vigil sitting, which could be in a client's home or in the hospital. We are just actually introducing volunteers at the hospital again for vigil sitting. We do grief and bereavement counseling service, phone calls, like a telephone companioning service, and visits from trained hospice volunteers. And we have a walk and talk support group and support for caregivers as well. So most of the funding for Ty Watson House and our programs and services, inclusive of staff wages and facility maintenance, is provided by very generous community support through donors and businesses. It's amazing, really, what our community thinks of our hospice services. So Ty Watson House is a treasured community asset and an example of how two organizations, Island Health's Community Health Services and AVS, working together can provide a much needed service. We're so proud of this relationship, and thank you for that. We also pride ourselves in our ability to understand the evolving needs of our community, hence our latest initiative, the implementation of our Children and Youth Grief and Bereavement program for ages 5 to 19. Now that age group is really assessed each time. If there was a 20 or 21-year-old, for instance, that maybe had some social issues, we might consider keeping them in that program at the onset. So in Port Alberni, families with kids needing counseling due to grief have struggled for the past 3 to 4 years, and there's very limited services available in our community locally. And a child could wait up to 6 months or more for one appointment. and they could be forced to go to a larger city with the parent losing time from work and incurring travel expenses and a child's full lost day at school. Excuse me. Grief can be from death or loss, abandonment, or anticipatory grief due to a terminal illness of a loved one. And in our work, we know that it could be from disease, aging, drug overdose, suicide in the family. We even recognize that it could be from divorce, family violence in the home. That brings a lot of issues up for kids, guilt and anxiety, misplacement from their home, their loved one. Children having to live in government care also have a sense of loss and a sense of abandonment as well. So as we heard earlier today, drug and substance abuse in our community has impacted us all, and in the Alberni Clayoquot 426 local health area profile, the stats speak to the alarming changes in our community, and substance-related death rates are reported in 2018 as one of the highest in British Columbia, and alcohol death rates also have been climbing. In 2018, we had the highest drug toxicity deaths per 100,000 compared to Island Health in BC. I actually couldn't believe that statistic, but it's true. So the children and youth of our community are impacted greatly from grief and bereavement in all of these issues, and unresolved grief for kids can manifest in challenging behaviors, a heightened sense of a loss of security, inappropriate behavior in school, frequent absenteeism, and unresolved grief can lead to substance abuse and increased visits to emergency rooms, as we are seeing in the last few years. And we firmly believe that there is an absolute need to grow our grief and bereavement counseling program for children and youth. And since the program's inception, which just started in September, that just passed through a generous community donation from the 100 women who care. They started us off with a $14,000 donation, and in September we had 2 or 3 kids' names, and right now we're at 21, and we haven't advertised a single bit. We put it on our Facebook page, and the numbers are just coming in, and we are conducting a campaign to let the community know a little bit more as of next month. But really, for us, it depends on funding. Right now, our counselor is employed 1 to 1.5 days a week, and we know that if we get bigger, we need her more. So to grow this, of course, we need increased sustainable financial support from within and outside of our community, and we know that we can grow through expanding into the secondary school, where group counseling has been initiated, and individual counseling at the hospice office through collaboration with the school district, parents, guardians, doctors, and nurse practitioners, and Island Health. And to date, the program has provided support, as I said, to it's 20 or 21 families, and expansion will require additional hours. So we also know that 31.9% of children under the age of 6 are living in poverty in our community based on after-tax low-income measures. The other disturbing trend from the cited source is that in 2018, the stats show that in the ACRD, we have the highest number of children and youth in care, with 26.7 per 1,000 within BC. That's terrible. This information is relevant due to the inability of families to pay for private counseling services, which are at an all-time low in Port Alberni. So our Hospice Society would welcome further discussion with Island Health regarding any potential collaboration to improve the well-being of children and youth in our community. And thank you for the opportunity to share this with you all today. And at the back of the room, at the table there, I've got some handouts and the pictures that are on the back table. I'll just give you a sneak peek at them. But our counselor is also a play and art therapist, and so she has provided us with some recreations of children's artwork, and you'll see a little description about it at the back table there. It's really heartening to hear and see what the kids think and feel, and to realize that we're helping them one step at a time. So thank you all for your time.
Thank you, Teresa. As a board and an organization, we deeply value our community partnership, so we really appreciate that you were here today. And I just want to ask my colleagues again if they have any further questions for Teresa. We really appreciate the work you're doing in the community. It's incredibly important, so thank you for that, and please pass that on to your staff and your colleagues. So now I'm going to open the floor for your questions. Please keep your questions brief, that is 1 to 2 minutes, to allow us to answer as many as possible before we adjourn at 6 p.m. We've also received some questions from the community via email, and I'll ask these in between your questions here in the room. So you can see we have 2 folk with roving mics, and someone want to ask a question, and then I'll read one from the email that came in. Otherwise, I'll just read one from the email. Okay. So the following question's been asked by a few people. We are concerned with Island Health's decision to suspend a doctor on the North Island when there is such a dire need for physicians and emergency services. Why is Island Health suspending doctors when our community needs more physicians and support, not less? So I'm going to ask Kathy if you would answer that question.
Thank you, Leah. Oh, that's good. And thank you for the question. I think it's good that it's out and we can talk about it. So I'm sure the people who've posed the question have been following online what Dr. Natters has had to say about the circumstances as well. Our Vice President of Medicine, Dr. Ben Williams, took an unprecedented step in issuing a statement, and that too is available online. Yes, we have a responsibility to ensure there's access to care. We have a responsibility to ensure there's safe access to care. And we have to put patient safety at the center of everything we do. And so I want to say I'm very grateful to the North Island leaders and Dr. Williams, who undertake this work with both focus on access and safety and trying to keep that in balance, and also a commitment to work collaboratively with all of the members of the healthcare team to support that delivery of quality care. As I've said before, I have complete confidence in the team in the North Island that we will find solutions to ensure that we can deliver that safe, quality access of care. Our focus has been to maintain, to work on stabilizing the services through the significant commitment that government has recently announced to build a foundation for the future. And that work and the work of the investments will take all of the members of the healthcare team and our community partners in the North Island to implement those investments and to improve the health system for Mount Waddington. And just to say, I know, because I've been in Mount Waddington, I know this is what our North Island patients have expressed, what the communities have expressed, and what our care teams need and deserve is a stable healthcare system there now and into the future.
Thanks, Kathy. Any questions from the folks in the room? Okay, thank you.
Hi.
Go to you next.
I'm just wondering why in Alberta they have hired back their nurses and we have not in BC?
I'm sorry, I can't hear you.
And doctors and nurses in BC, why they're not hired back and they are in Alberta? What's the difference?
I'll start, and I may ask
Okay.
Dr. Allison as our medical health officer. So here in British Columbia, we're still under the provincial health officer order. So there's still an order, which is a law that we must follow that requires all members of the healthcare team to be vaccinated. Do you want to add anything?
Thank you so much. I agree fully with what Kathy has said. And we know that within the healthcare setting, healthcare team members contribute to the safety at the site, as well as, you know, when we're thinking about caring for the patients, we want to make sure that we're as prepared as possible. And so that's the mechanism and the reason behind that provincial health officer order, which is in place. And so we, because it's an order from the provincial health officer, we continue to respond to it. And when that changes, then we'll change as well. So thanks.
Maybe I can just get you to stay up here because the next question is going to be directed to you as well. And it is that, and again, this question's been asked many times, can you kindly explain why the ambassadors are still asking for vax passes at the West Coast General Hospital? And why are there still vaccine mandates when vaccines have been proven to be deadly?
Thank you so much. Well, certainly I have been vaccinated, and I know many of my family members who have benefited from being vaccinated. And so certainly we understand that there can be harms from vaccine, and we monitor for those carefully. The BC Ministry of Health does provide the requirements for the COVID-19 vaccination. In regard to people seeking care, we do not require vaccination for people seeking care, but regarding people who come into our facilities to visit, we still do check for vaccination status. Now, if there was an issue related to the mental wellness or an urgent need for visitation, we as medical health officers are very willing to give, you know, exceptions or exclusions and allow people to visit, because of course we don't want to get in the way of that. But again, it's a balance of the safety of the system, really trying to you know, heed the orders that are coming from our provincial partners, and also meeting the needs of the patients in the facilities, because we care for all of them. So.
Thanks, Dr. Allison. So Tyler, there's a gentleman up here with a question right at the front of the room. Thank you.
It's, I probably have to explain somewhat of my history first. I had a very bad motor accident and broke my pelvic bone in 3 places and broke my 7th thoracic vertebrae, which went undiagnosed for 10, 12 years. In collaboration with my chiropractor, we decided I should just go for a complete disability, as I was really having difficulty. While they were deciding my fate, I read a book about cranial sacral therapy and thought I could still be of some use to the community if I explored this. I took a 2-day introductory course, and my body went through all kinds of changes, and I went down island and worked in a small sawmill for 3 years, pulling lumber on the green chain to see if I could reach a limit to this. And I'm still in excellent health, and I haven't seen my chiropractor in years and years. So I can attest to the benefits of cranial sacral therapy. The second part of cranial sacral therapy is somata emotional release, which is body emotional release. Apparently we carry a lot of our emotions in our bodies. The Upledger Institute has been doing work with returning military personnel since 1999. If it wasn't very successful, they wouldn't be invited back. I know for myself, just as a side effect of the cranial sacral therapy, I recognized a lot of emotions that were inappropriate. So I'm also a beneficiary of somato-emotional release. They're talking the drug crisis and balancing their bodies, but it's the emotional trauma which drove them to drugs and alcohol. So being able to balance my body so I don't go into withdrawal is not going to help me any with the emotional trauma. Now to my question, would Island Health fund a cranial sacral therapist who's familiar with somato-emotional release in the community here so that this would be available in the community?
Thank you for your question. Kathy, do you want to start and then pass it on? Or?
I will start and then pass it on.
Okay.
So, you know, I think what you're pointing to are what we would call the many disciplines, alternate care providers, alternate therapies, holistic therapy, naturopathy, a number of therapies. In the health system, so as employed in Island Health, you must be a regulated health care provider. So have to be regulated by a licensing body here in British Columbia. That said, we're exploring partnerships, and we've just initiated some resiliency grants working with community providers in this area of wellness, health promotion, and getting upstream in terms of some of those social determinants of health, and as you've said, some of the trauma that triggers addiction or is the genesis of addiction. Those grants might be a way to explore some of those alternative therapies. That way they aren't employed by Island Health, but we'd be partnering with community partners to explore what might be possible. My colleague Kiva Glenn is here, and also Leslie Howie, and I don't know if you would like to add anything in terms of what we're seeing as we put those grants out. I know we haven't released the money yet, but if you're seeing anything in terms of alternative therapies coming in from members of the community.
Thank you for sharing your story. And thank you also for highlighting the role that trauma plays with addiction, because as we know, that is at the root for the vast majority of people who are struggling with addiction. So I really appreciate you raising that. Kathy mentioned the grants that we have put out, or the call for grants. There are two streams, and well, for better or for worse, well, neither of them exactly address what you've put forward. But one of the streams is with businesses, and we're looking for people who have, or businesses, especially businesses in the trades, construction, hospitality industry, and creative ideas to support people. And this is where your suggestion could come in, creative ideas to support people to stay in the workforce, and connecting those ideas to their businesses. So your story about being able to return to work and stay for 3 years is an excellent one, and I think a really nice fit as well with the idea of the innovation grant with businesses. The second one, stream of innovation grants, connects with what Dr. Allison was talking about in part, and also the presentation on from hospice and their support for youth. This is a youth resiliency grant, and we've had tremendous response across the island, over 200 submissions on this grant application. And the idea is to really focus upstream. How are we supporting the prevention components, and prevention in terms of age and prevention in terms of mental wellness too, all those social determinants of health that we know contribute to sustained happiness and mental wellness. So we should have our results and our analysis of those submissions in the next few weeks, and the grants will last for 2 years. So it's a really exciting and creative way for us to try to extend our reach beyond the more conventional health system.
Thank you, Kiva. Okay, question at the back.
Tlaco, Uchlashis Tlaquakila, is Takshitla Utsqueeze Chisma, Utsqueeze Haktuamit. And I want to say thank you for having this important discussion today. My name is Tlaquakila, holder of the copper. His Takshitla Hoset, I come from a Houset. I work here in the valley at the hospital, in fact, as one of the tech support guys. I like the idea that you shared the importance of data, data-driven and data-supported healthcare applications. And the reason I find that's very important to me is one of the things I'd like to ask is, what is the data saying about some of the differences that exist within the Indigenous communities, the people who live in the valley, when it comes down to healthcare expectations, healthcare interventions, like if, say, my dad, I used the word MIT, he passed away liver failure. And I just want to ask what the data is going to say about the difference in our biological makeups when it comes down to things that might affect us differently. Not only with the liver and exposure to alcohol, because it's only been 3 or 4 generations tops. European and other nations have had exposure to such things as alcohol for many, many generations. It doesn't make you better, it's just that exposure has allowed us a bit of adaptation. Along with that comes other thoughts of dietary differences, you know, our exposure to other processed foods and our exposure to things that we never had in our staple. And then it brings to mind pancreatitis issues, which tend to be diagnosed as idiopathic pancreatitis amongst the ranks of our people. Gallbladder, diverticulitis, stuff that all seems to be related to the digestive system or the urinary tract system one way or another. And I'm just wondering if there's a way that this whole idea of reconciliation is underscored by the fact that we're looking at what the physical makeup is that lies between us, the differences that are there, the similarities that are there, and how we can work within that, the Venn diagram, if you will, of population subsets, so that we best serve each subset to what their needs are and not just kind of make one cookie cutter and hope everyone fits in it. Thank you for your time.
Please accept our most sincere condolences for your loss. I really appreciate you under those circumstances, particularly getting up and asking your question. And so Sandra is going to respond, to start with anyway.
Thank you so much, and thank you for being vulnerable and sharing your experience. It has been brought to my attention as a medical health officer that community has concerns about different things like you've described, and I just, if you would give me time after this, I would love to connect with you.
Hello, and just to the one doctor here, you know, Dr. Williams, Sam Williams, she did a big job. She really looked after my dad, and I can't say thank you enough. So I wanted to part on that there is good work being done, but I think learning is always a wonderful thing. Thank you.
We'll make sure that Sam gets that message. Thank you for saying that. So we did receive a question by email from NANDU, the Nanaimo Area Network of Drug Users, and I just wanted to say out loud that we will get back to them with an answer to their questions. We won't do it here, but we will get back to you with an answer. Are there any other comments or questions? Oh, here we go.
Since nobody's going to talk, I'll ask questions. Bill 36. Do we know about it? Is that mandating, or is that in the bill that they can mandate any vaccine to be taken by anybody that the government has said that you have to take? Do you know about that, and do you support that?
Sandra's shaking her head, so if Sandra doesn't know, then we don't know. So can you leave your name with us and we'll get back to you about that? Thanks. Any other questions? As a governance board, we are accountable to you and the people we serve in the communities on and near Vancouver Island. And that is why it's so important to provide opportunities like this to hear from you. Thank you to everyone who submitted questions or stood up to ask questions. Thank you to Kathy, Dr. Allison, Shelley, Alicia, and Teresa Ludvigsen. And thank you to everyone who came today and tuned in. Those of you who tuned in on our live stream, we appreciate it. So with that, I will close the forum and thank you again for taking time to join us today.